All right. Yeah, I say go for it.
Okay. Cool. So when Brandon first suggested discussing the impact of COVID on our homeless community in LA, I thought that was really important, just because I think obviously COVID is something that we can all relate to. We've all been impacted by it in various different ways. But I think it's always helpful to take a minute to really I guess kind of explore how COVID's impacted some of our more vulnerable populations, because what has come out, and probably as many of you are well aware, many of our vulnerable populations are the ones that are most impacted by COVID right now. So there's obviously, we know how people who have certain medical issues are impacted by COVID disproportionately than others. We also, I know information has come out that the people of color, and specifically the Black community, has been disproportionately impacted by COVID. And our homeless community has some really unique vulnerabilities related to COVID that we're still, and I kind of, as I shared earlier with Ken when he was asking for information, that we're still kind of exploring, because I feel like every week we're on calls with Department of Public Health and Department of Health in LA County, and new information is constantly coming out as far as the barriers that our homeless neighbors are experiencing and how that makes them vulnerable to COVID, and just the different barriers that we're experiencing as we're trying to address those issues, and the barriers that we're coming up against as we're realizing that to address issues of COVID within the homeless population is not just a simple task. It's pretty complicated, and I'm going to go into more detail about that in a few minutes. But I also think that given everything that's been going on right now in our country over the last couple weeks, that it's also very timely, because just like COVID has really highlighted a lot of our unjust and broken systems, homelessness kind of does the same thing, because homelessness is one of the issues that literally intersects with almost every social issue, and in some senses is kind of the culmination of a lot of different broken systems. So I think that when you really look at homelessness as an issue, you kind of automatically are looking at all of the other systems that intersect with it. So things like lack of accessible mental health and substance use services has impacted homelessness. Lack of support for folks that are moving through the criminal justice system, especially those folks who are released from incarceration, that intersects with homelessness in a really big way. As I've shared in the past, youth homelessness is another big one. There's a lack of support for youth who are exiting the foster care system. A large percentage of the youth that we see experiencing homelessness between the ages of 16 and 24 are youth who have at some point come in contact with the foster care system, or who have actually exited from the foster care system into homelessness. And then there's a huge intersection between homelessness and housing instability and things like domestic violence and human trafficking. So a lot of our folks that are experiencing domestic violence and human trafficking are oftentimes either become more vulnerable to that because of homelessness and housing instability, or experiencing homelessness as a result of a domestic violence relationship. So that being said, as you've probably been hearing in the news, and we can obviously discuss this more and more, and as you would probably know from just having conversations within your community, the Black community specifically has been, just like I said, mentioned earlier, has been disproportionately impacted by COVID. They are also disproportionately impacted by homelessness, which is probably not surprising considering the fact that all of those different systems that I just spoke about tend to disproportionately impact the Black community as well. So I thought I would give space just for a few minutes to kind of review just a few statistics. And I don't want to throw a whole bunch of numbers at you when I don't really have a physical way to show it to you, because I know that can sometimes be overwhelming. But I also can give you guys access to the actual report that I'm reading from, because it is accessible actually through Los Angeles Homeless Services Homeless Services Authority's website. So anyone can access it, but I can get you guys the link as well. But there's a few things I wanted to highlight because in 2018, the Los Angeles Homeless Services Authority launched the ad hoc committee on Black people experiencing homelessness. So essentially, it's a committee that they put together of people with lived experience who are from our Black community in Los Angeles. And one of their aims is to really do some research around why there's a disproportionate amount of people from the Black community experiencing homelessness, and putting together some different suggestions on ways that we can better address homelessness within the Black community. So I'm not going to do it a whole lot of justice in the sense that this is a 115-page document, and I don't want to. I think if it's something that would interest you, I think it's definitely worth taking the time to read, because the folks that have dedicated their time to this, some of them I've worked with personally, are amazing and have much more informative perspective than I could ever have. And so I think it is worth hearing what they have to say. But there's a couple of things I just kind of wanted to highlight just to give us a little bit of perspective on the issue. So a lot of these numbers too are based on the 2017 homeless count. So as I was mentioning when Mina had asked earlier, the way that we kind of gauge our homeless numbers is by doing a count every year where we're getting an idea of how many sheltered and unsheltered folks that we have in LA County. And so we do that in the January of each year. And so the numbers for 2020 are about to come out, but not quite. So the numbers that are on Los Angeles Homeless Services Authority's website right now is based off of 2019 numbers. But the report that I'm going to reference is based off of the 2017 homeless count, because that was the homeless count numbers that had come out when this committee was started and when this report was first started. So in the United States, the Black community makes up 13% of the general population, but they make up 40% of the homeless population. In LA County, they make up 9% of our general population and still 40% of our homeless population, which is a huge disparity and the largest among all of our ethnic groups in LA County. One of the things that the ad hoc committee was looking into was the different areas that have contributed, the different areas, and when I say areas, I'm meaning kind of like the systems and resources and the lack of those things, specifically for the Black community, that's contributed to this disparity. So the first one was housing. So as a result, and I'm going to read a couple things that they said, as a result of the vestiges of redlining and exclusionary zoning, which again, I'm assuming that you guys kind of have a background on this. I don't want to go into detail too much about it right now, but we can always discuss more a little bit later if you guys have questions around it. LA County ranks as one of the most segregated metropolitan areas in the United States. Over the past 2 decades, Black homeownership has declined at nearly 5 times the rate of white home ownership, according to a study by the Urban Institute. The same study found that while home ownership rates have increased for every other group over the past 50 years, Black home ownership has fallen to levels similar to those before the passage of the Fair Housing Act. And in Los Angeles specifically, a 2016 report found that white households have a median net worth of $355,000 compared to just $3,500 for Black households. So you can see right there that that's a major disparity in regards to housing and income. In regards to cost of living, the average rent in Los Angeles County increased by 32% from 2000 to 2015, while the annual median income of renters decreased 3% during that same period while adjusting for inflation. 17% of Black workers in Los Angeles County were unemployed compared to 9% of white workers. The study found that while education helped bridge the gap, it did not completely erase it, because 9% of Black workers with at least a bachelor's degree were unemployed compared to 7% of white workers. And whether working full-time or part-time, Black workers earn less than 3/4 of what white workers earned. And Black households in Los Angeles County also had the lowest median income and were more likely to live in poverty than any other racial group. Just a few other statistics. In Los Angeles County, Black people represented 30% of the overall population in county jails. A large share, 64%, of unsheltered Black individuals experiencing homelessness reported involvement with the criminal justice system, and that's according again to the 2017 homeless count. And then, it might sound obvious, but just wanted to point out, when one family member is incarcerated, particularly the primary wage earner or head of household, the entire family unit is at risk of homelessness. And then finally, in regards to child welfare, as of 2014, Black youth in the United States made up 24% of children in the foster care system, and only 14% of the total population are the age of 18. And according again to the 2017 homeless count, 16% of Black unsheltered families with children reported foster care system involvement, compared to only 2% of unsheltered families of other races and ethnicities. And then specifically to the transition age youth, which is our youth 16 to 24, there was an estimated 2,782 transition age youth experiencing homelessness in LA County, 42% of whom identified as Black, and many of them interacted with the foster care system at some point in their lives. So again, that's throwing out a bunch of statistics, which may or may not mean a whole lot depending on how you learn, because I know I'm, for one, I'm someone who needs to kind of see things visually. So hearing it, of someone kind of telling it to you may or may not do a whole lot. So I would encourage you to go back and read this report if you have time. And again, I will give you guys the link for that. But what I'm hoping to kind of highlight is a little bit of perspective into the disparity that's going on with homelessness and obviously the other systems, and why that's such an important thing to understand, specifically right now in LA County, when we are dealing with COVID and dealing with a lot of just our Black community and other people of color experiencing these racial disparities and feeling unsafe and uncared for and underrepresented in our community. And so I'm hoping to speak a little bit to that and shed some light on that. So I guess that's kind of the first phase of what I was hoping to kind of talk about to give sort of perspective on the issue. I kind of want to switch right now a little bit into how COVID is kind of impacting the way that we are working with the homeless population right now. So something that might seem, well, actually, I don't want to say something might seem obvious. I'm going to get to that in a second, because actually this was something that kind of threw me off myself when I started thinking about it. So one thing to understand is people who experience homelessness age faster than people who are housed. Research also indicates that they have physical conditions that mirror those of people 15 to 20 years older than them. So a lot of that has to do with our homeless folks who are living outside or in their cars or in other places that are not intended to have people live in them. And so not only does that physically put a lot of wear and tear in your body, and also trauma that affects your mental and emotional well-being, but it also impacts your lack of access to healthcare. So things like going and driving to the doctor, even calling and making a doctor's appointment, is not something that's easy because there is a lack of transportation. And a lot of people don't even have access to phones or other kinds of technology to even do that. And so a lot of our folks are out living in encampments who may never see a doctor and haven't seen a doctor for years. And let alone the fact that there's a distrust for a lot of our systems, and they haven't always had good experiences when they've interacted with other people who've offered assistance. And so some of them are fearful around getting that kind of healthcare. So our unsheltered population are really at risk for all of the things that make people at risk of getting COVID. And so one of the things that happened when COVID first came out was we were really, really fearful of COVID impacting the community and it spreading within our community, because when COVID first became a thing, the people that seemed to kind of be impacted the most by it were people that were doing a lot of travel between other states or international. And our homeless community obviously doesn't travel in that same way. And so at first our homeless community hadn't really been impacted by it at all. So we were really grateful for that and wanted to prevent it from happening. And so the first thing people were thinking was, well, why don't we try to get people in shelter as quickly as possible And there was like this push to just shelter as many people as possible that were on the streets. And as you know, or maybe you don't, Los Angeles County has the largest unsheltered population in the United States. So a lot of our folks are not sheltered, and even if they wanted to be sheltered, we don't have enough shelter resources for them in LA County, which is actually a different situation in a lot of other states. So a lot of other states, when you don't see your homeless population on the streets, it doesn't mean that they don't exist. It just means that they're probably sheltered because there are resources available to shelter them. LA County, we don't have that. And so we were hoping that we could do a really like quick push to try to shelter everybody as quickly as possible. Then we realized, as we were busing people to congregate shelter sites, that what we were doing was creating a greater risk of them actually getting COVID in that type of a situation, because when they were in open air environments and encampments and more spread out, they were less at risk. And now all of a sudden we're trying to house people, which we want to, or not house, shelter people, which we want to do, because obviously when they're unsheltered, they're more at risk of these physical conditions that leave them vulnerable to COVID. But when we try to shelter them, now we're putting them in spaces where they can't social distance and where they're interacting with people that maybe they wouldn't have interacted with before, and potentially puts them more at risk. So that was one of the first things that we realized is a major complication around COVID in our homeless population. So the thing that we decided to kind of do, probably, I have Carissa here to kind of reference because she also works in homeless services, so she's been a part of this too. I would say maybe a few weeks to a month in, would you say? Mm-hmm. We realized that we needed to do more of an approach using motels or RVs or other types of situations where we could keep people in separate spaces so they had the ability to self-isolate without being in congregate places where they were all living together in like a dorm style situation. So we started to kind of abandon the idea of using rec centers and started looking into the idea of motel rooms and RVs and things like that. That has been largely effective. However, we have to use whatever motels are willing to work with us, which means that a lot of these motels are not necessarily near grocery stores or other places where people can easily access food. They're oftentimes not next to public transportation. And so now we're back to a situation where we're trying to protect people, but we're putting them in locations that don't necessarily help them get access to the resources that they need. Let alone just the loneliness of having to be isolating without your normal ability to interact with other people, being moved from the community that maybe you were most comfortable in to a different community that you don't really know anybody and you can't really access anybody really easily. Your case manager you might not see as often because maybe your case manager is working a little bit more remotely than normal. So we were dealing with a lot of loneliness. And then we were having issues with a lot of our folks who were employed, but probably underemployed, but at least had some kind of income coming in. Were now losing their jobs. And so now they didn't have the basic income needed to even afford food, even if they could access it. So we were having to kind of work together to mobilize efforts to try to get food to people in motels. Also realizing that a lot of them didn't have refrigerators or microwaves. So the kind of food that we would provide to them had to be something that was shelf stable and had to be something that they could easily make without the use of a hot plate or microwave, which was another unique kind of complication that we didn't anticipate. So this kind of leads us into Project Room Key, which if any of you guys have heard on the news throughout the last few months and heard of Project Room Key, it was an effort in LA County to try to get 1,500 or 15,000 beds? I think it was 15,000 beds throughout LA County, where we could, 15,000 beds in motels, where we could get, move people into those motels where it would be a safer place for them to be, where they could still self-quarantine, and try to get that many people off the streets. That was the idea. And as you can probably imagine, that was met with a lot of opposition because already there's a lot of concern and stigma around having homeless folks come into people's neighborhoods, even though most of those folks were already living in those people's neighborhoods to begin with. But any thoughts of bringing shelters into a community and turning a motel into a shelter is a really tough topic for people. And because of how quickly we had to move, we didn't have the opportunity to do town halls and things like that we normally do to try to get the community on board. We just had to move quickly. And so very often the community found out after the fact that we were using a motel in the community. And a lot of people started to protest against that because there was a lot of frustration that we would do that and that we were potentially bringing COVID into the community. Which, if you have heard any of that, I would like to take a minute to just say, like, we made sure that the Department of Health and LASA worked with all of our providers to make sure that we had 24/7 support at all of those motels. We were providing food so that people were able to self-isolate, and there was always nurses on call or physically there. Actually, I think we also always had nurses physically there to do temperature checks at least 3 times a day, so that if anybody did report symptoms, they could get to the hospital immediately, and we would never have a situation where we would have a breakout of COVID at a motel, and still haven't. So it was actually a really safe way to get people off the street, get them in a place where they could actually isolate, and then provide them with services so that they're not completely lonely and not able to meet their basic needs. It was actually a really cool, effective way of handling COVID. But I think there's a lot of misinformation around that that's caused a lot of confusion and frustration for communities where Project Room Key ended up showing up. So that was kind of, at least up until right now, that's been kind of our main way to try to get people who are vulnerable to COVID off the streets. If somebody does report symptoms, we are also using motels as quarantine isolation sites where we have nursing staff 24/7 providing care to those folks. So basically anybody who was either asymptomatic or who was symptomatic, but it wasn't a situation where they needed to be in the hospital, they would be cared for in these motels with nurses 24/7, making sure that they were okay and fed and that their basic needs were being met. So those are kind of the 2 ways that we've been using motels and RVs and things like that in the county right now. Another unique kind of situation that has come up more recently has been in our permanent supportive housing sites. So in our permanent supportive housing sites, these are places where chronically homeless folks with disabilities are now living permanently for the rest of their lives. They have this subsidized housing situation. And sometimes you see that in the forms of vouchers, where people will take a housing voucher and move to different places within the county. But sometimes you see it in what we call project-based, where there's a whole apartment complex that's basically reserved for these folks. So I oversee one of those in the city of Pasadena. And it's specifically what we call a single room occupancy. So it's a situation kind of like a dorm, like a college dorm, where you have your own room, but you share your kitchen and your bathroom. And what we realized is, even though this was a little bit better than a shelter setting where you're in a dorm, where you're all in like one room, it's better in that you have your own room, so you can isolate a little bit better. But because you're all using shared spaces with kitchens and bathrooms, people were still interacting with each other. And so it was really hard for us to make sure that COVID wasn't spreading amongst people in those situations. And so we've had to work very closely with the Department of Public Health to try to make sure that we're monitoring these sites to make sure we don't have an outbreak in these kind of sites, which has been really difficult. But what we've had to do is really, really crack down on social distancing and self-isolating. And so what we've realized is that we have a lot of loneliness within that community. So a lot of these older folks who are there with disabilities, who don't necessarily have great connections with family and other supportive service, like other natural supports in their lives, are basically there really, really lonely. And so part of what we're trying to explore right now with my team at Union Station, but it's something that like I also wanted to bring to you guys and something that we can talk more as we discuss, is the idea of if COVID is something that's going to continue on for potentially another year, maybe even 2, how do we protect our vulnerable members of our community? And as I shared before, all the different kind of complicated things we hadn't thought of before about how to make sure that we don't put them in a situation where they're going to be more at risk of COVID, but still meet the basic need of human interaction and community integration, because that's such a big part of helping people thrive in their community. How do we do that in a way that's safe? Because these are situations that if you were to bring in COVID into a situation like that, people could get really, really sick and it could spread really, really quickly. So how do we protect while also making sure that their emotional, mental well-being is being taken care of and they're not completely isolated from the rest of the community? So basically I just threw out a ton of information. and I want to make sure that we leave room to still discuss. So I'm going to be quiet. But I guess if I could just sort of sum up kind of what I've shared is thinking about homelessness as a reflection of our broken systems that we have in our country, specifically how it's impacted people of color in the Black community. And then this unique situation we have right now and how we protect a vulnerable population from COVID while also making sure that we are being mindful of their emotional and mental well-being and just their basic needs like food at the same time. So Brandon, I apologize that I've thrown out a bunch of different thoughts and verbally processing, I think, as I go a little bit. But if there's any thoughts or any questions around anything that I've shared, I'm all ears.
Kathy or Mina, do you have questions, or Beth?
Todd?
Who provides the funding for the motels? Is that like through the Alliance?
So FEMA was actually providing a lot of the money for Project Roomkey. I don't know, I can't remember if it was all of it or a portion of it, but a lot of it has been funded by FEMA.
How long can they stay there?
So it started out as a 90-day project, but that's another thing is right now, so we've just put a bunch of people in motels that when the 90-day mark comes up in the next 30 to 45 days, what do we do now, right? Because we don't know that we're any safer from COVID than we were, or that we're not going to get a second wave of COVID. And so to get people who have now adjusted to having a roof over their head to have to go back to the streets is probably not ideal, right? So now we're trying to figure out what our next step is. Do we ask for another 90 days? Do we focus services on trying to specifically house the people that are in shelter right now? So part of the discussion has been maybe pulling some of the money from some of our other homeless services and putting it towards specifically the people that are in those motels and trying to focus on them right now first, which is great, but also pulls money from other people who are being served. So we don't really have a clear answer right now.
So I have a question. There's a population of the church that's now much more comfortable going out. They're still careful that they wear masks, but they're starting to ask questions about what they can do to be supportive of vulnerable communities. What would your response be? Should we just be donating money, or are there other hands-on things that we can do, or can we call council members? Anyway, what can we do to be supportive of that work?
So we do have a need. And so what we did notice is that when COVID first hit, we had some people who were more willing to jump in and help donate some food and things like that now have kind of, so basically we had some local restaurants that had the ability to focus on donations because they weren't operating. Now that they're operating, they've kind of pulled back. So we've lost some of our donations. And then the individual smaller communities like churches and families and schools and other kind of like Girl Scout troops and things like that, where they would adopt certain meals that our shelters would need, or would help with different donations that our agency would need. We saw that kind of fall off when COVID first hit, just because everybody was in a strange economic place and nobody was sure kind of how to prepare around that. So we've seen a lot of change in the way that our donations have come through. And so it's been very unpredictable. And so it's been very hard for us to really plan and know from month to month what we're going to have. So the reality is that we can always accept donations. And I had there's a list of kind of the specific things that we've been looking for our individuals and families who are experiencing homelessness, anything from hygiene to food to diapers to formula. I mean, there's a lot of different needs like that. We haven't asked for a whole lot of volunteers to come into any of those sites because, again, we're trying to make sure we're not bringing COVID into any of our really vulnerable sites. However, that may be something that starts to change in the next few months. And so part of what would be good for us to know is who wants to be a part of that. So if we do get to a point where we, so I know I had shared with Brandon, we had a group that would come in and do a monthly meal at this permanent supportive housing site I was just sharing about in Pasadena. And it was a time for all of the community to come together and eat together, and it was something our residents really looked forward to. And that since has kind of fallen away since COVID started. I don't know that we'll get to a place again where we can do something like that. The hope is that we can, and we can creatively look at how to do that while social distancing. But I think there's a lot of fear that people have, thinking that if they were to come into a setting like that they might be more at risk for COVID, when the reality is it's kind of the other way around. Our communities aren't really more of a risk. They're just more at risk of getting really sick from it. And so if we do need people to come in, it would be nice to know who's willing to try that out with us and to get creative with us and how to do it. We also have been trying to get volunteers to be what we call phone pals. Basically trying to get volunteers to offer to be like a pen pal, but over the phone with our folks who are stuck in motels who do have access to phones. So not everybody does, but those who do, to be able to have someone kind of checking in on them and making sure that they're not so lonely, and then making sure that they're okay. Because actually in the very beginning, when this first happened, we had a few of our older, more vulnerable folks who passed away, which happens. That's not unusual, but we didn't always know it had happened. And so we usually, when we're there more often, we're checking in more often, but because resources were more spread out, we didn't always know that had happened. And so having somebody who's regularly able to check in is helpful, because if somebody does get sick and nobody knows that person is sick, we may not be able to respond in time. So that's another thing that has been helpful, is having volunteers checking in with our folks and seeing how they're doing. And what were you saying, Chris, what were you saying about, what are some of the issues that you think, as far as like calling council members and things like that we could really...
Do these volunteers check on them? Do they go through like a screening background?
We do have a little bit of a process of that, to sign up to be a regular volunteer with Union Station. But not, I don't know if they do background checks, but they do like a training kind of orientation around that, so that people are prepared.
I think that there is like another, last like LA homeless collaborative committee I was at, there's a couple other bills on the floor that like around another stimulus package that would I don't know where, like I think 2 weeks ago, around that would help with more continued funding towards like rapid rehousing and homeless prevention, because I think I do like we pushed like the things that the homeless providers have done, I think, for the homeless community, and what we've accomplished is like really crazy. And I think it's really great how quickly everybody like mobilized and what we've been able to do, but we need to now sustain it. Like we made the choice to kind of take people out of encampments, and to people like left their tents, they left their communities, they left the spot they had on that sidewalk. Someone else took it over. If they gave away their things thinking like, oh, I have a motel now. And that was something we really like pushed, because, and so now when these like 90-day timeframes, or like when the money's up from the CARES budget, that like the different funding sources, everybody's just kind of like, yeah, we don't know. And I think that's a very unacceptable answer, because what that means is that it's either we're going to kick people out and now they don't have the tent anymore, they don't have the community because we separated all of them, and they don't have the spot where maybe they were safe on that sidewalk. And so I feel like when we initiated this, like the unintended consequence may be that people go back and have to start from scratch, and like just how all the statistics Sarah gave of like health concerns and how people are disproportionately affected. A lot of how like encampments work are that they rely on each other to do certain roles, and now we've separated that, and so they have to recreate it. It can be very dangerous, it can be very hard, and it can really take a toll on people's bodies. So I don't know. I know there's a couple things on the floor. I can't remember the bill that it was. I don't know if there's more even, but I think if there's a way to figure out like what could be pushed for in the community, like what can we say, like raise voices to say, yes, we want this, because we push something and now we need to see it through to some extent, because it's going to be detrimental to the people we've placed, and it wasn't even their choice. And a lot of ways, if we just say, well, the funding ended, figure it out. And I think we talk about like, even holistically, we talk about that, like what we'll do to our homeless neighbors, but then also sometimes we, like the staff and the people that do the jobs, we need to keep those people there doing them. And it's incredibly exhausting even to the staff, sometimes who have been homeless themselves, who now have these jobs, to then be told to do sometimes impossible tasks. And so I think when you talk about a community as a whole, the people who we're trying to serve, but also the people doing the work, to have like these ebbs and flows or just like figure it out when you're given like really hard situations, it's incredibly, it wears people down also. So like, not that that's maybe not the major focus, but I think that it's something to take into effect is it burns you in the staff to people, and for them to have to go into that when a council member makes a decision and the person on the front line who had the rapport has to go in and say you're out, and they say where, that's a really hard conversation that you just enter into suffering with that person. And I don't think it has to happen. It's gonna cause a big problem. I think that's like my biggest worry is what will happen when they cut funding or when they decide it's safe to go back or who knows what. And so I think that's where maybe trying to figure out like what is it that's maybe on the floor that could provide funding, or how can we say, maybe even it's just calling and saying it's not acceptable to like put people out after a certain time. Like we have to come up with a better solution, whatever that is. I don't know what that is.
Well, and I think I think Carissa hit on a really good point that, so obviously, like when if you're somebody who's experiencing homelessness and you've gotten to that point, there's probably a lot of your rights have been infringed upon along the way, and you probably don't really even feel a whole lot of, you probably feel a complete lack of power over your life and your ability to make any kind of decisions as it is. So it's something that we try to be really mindful as homeless services providers to really make sure that we're respecting a person's autonomy in their decision making, whether we agree with it or not, because these are people who haven't really experienced a lot of respect for that in their lives. That being said, when COVID hit and we really realized we were in trouble if it hit the community in a really negative way, we had to make decisions with the Department of Public Health that I don't want to say we ever disrespected somebody's rights, because I think we've always really tried to be careful how to respect that. But like Carissa was saying, we found ourselves in situations, like I said, where we were busing people to rec centers, right? Like, and I don't want to say we didn't give people a choice, but I think we kind of really pushed it because we were so afraid of their health. And so we were trying to avoid there being a huge breakout among the homeless population. So it was a real big push, and found ourselves in a situation where we're the ones in power making this decision for them. So we really have to be cautious of what we're doing. And we're putting people on buses and sending them to rec centers. Like we just possibly just put someone's life in more danger without even meaning to. So we found ourselves in a lot of situations where we were making decisions for people that we wouldn't normally have done, or pushing people, really kind of putting a lot of pressure on people to make certain decisions because we knew that was what was best for their health. But at the same time, put them in very vulnerable positions because they weren't always super autonomous in how they did that. Mm-hmm. So I think what Chris is speaking to is now we've put people in a bunch of motels, which again was much better than the original idea, which was a bunch of rec centers, which is still operating, mind you, but like we realized that our 65 and older folks and our folks with specific physical conditions could not be in those kind of situations. So that's where Project Room Key came in with the motels. Mm-hmm. So that was a really good idea. But for you, to what that does to a human being's body, to go from adjusting to knowing how to live outside to then going into a sheltered situation and then all of a sudden not knowing again where you're going to go is traumatizing and really, really hard on somebody's physical body. So I'm just highlighting that I think that that's something that's really important, that things that we may not think of that are specific to the homeless population, and why we really need to advocate for what's going to happen on the other end of these 90 days. And so if you hear about Project Room Key in your communities and you hear a lot of negativity around that, part of it too is what we're saying, like how we're spreading the truth and the messaging around that, right? So Project Room Key does not mean we're bringing a bunch of people who have COVID into your neighborhoods. What we're doing is bringing a bunch of people who are extremely at risk of getting COVID, and so we want to prevent that, into motels that are safer, and then have staff who are monitoring their temperatures on like at least 3 times, if not more, a day. And there's always somebody there making sure that those people are being cared for. So if anything, they're getting more support than probably they've really gotten in the past. Yeah. And it's not a big scary thing. It's actually a pretty safe thing, and really one of our safest options right now. And so the messaging around that if you hear people negatively talk about that in their community is really important.
That's true.
Because we didn't, and that's LA's fault a little bit, that in trying to, they kind of kept it hush hush because they were trying to protect that community, and I respect that. But in keeping it hush hush, there was a lot of misinformation that got out with the community because people didn't know what it was, and it scared people. So now we're having to kind of go backwards and improve the messaging around what Project Room Key is all about. Mm-hmm. And we have already, so we're in discussions right now with like our leadership team at Union Station, and I'm sure this is happening I'm at all agencies right now that have been providers with, specifically homeless service providers, that Measure H, which is the funding that came out a few years ago that was kind of aimed at us building the coordinated entry system in LA County. So it's just more of a streamlined process and making sure that we're really serving the most vulnerable, and that there's accountability to the homeless service providers to do this together and to do it well and to do it equitably and not just do it in silos and cherry pick who they want to help. So it's a really important and great thing that LA County is doing right now, but we're doing that with the assistance of Measure H funds. There's been talk about Measure H funds being cut to some degree because of everything that's going on right now in the economy. And if that gets cut, then those are also services that, you know, like service workers and services aimed at addressing homelessness in LA County, which was a major issue before COVID hit, and is going to probably become an even bigger issue because a lot of people are experiencing housing instability now because of COVID that weren't before. So we have a lot of people that are probably going to be months behind in rent and need assistance with rental arrears, which we used to help with, and we hope to continue to be able to help with. But if Measure H funds start to get cut, then that prevents our ability to be able to help with those things. So it's not just the homeless community now, it's anybody in our community who's been impacted by COVID and job loss and things like that, and is now in a situation where they're behind on the rent and are going to need to get assistance getting caught up. Those people could be impacted by cuts.
Mm-hmm.
How are the homeless people able to get clothes and food right now? Do the churches feed? Salvation Army?
So I can speak just from...
Are they on food stamps?
Yeah, so the good thing was anybody who was receiving government benefits, like through Department of Public and Social Services, Department of Public and Social Services did make sure that people had access to that and that didn't get interrupted. In fact, for some people, they made some adjustments so that people's benefits were not cut, and in some cases some things even increased a little bit, so that was okay. But again, it was things like even I kind of didn't really know that people are going to experience until we were in the middle of it. Things like, now you're in a motel that you can't get public transportation, or you're not by a grocery store, so even if you had those funds, how are you going to utilize them? Or money is getting spent on things like, if you guys remember, grocery stores were really hard to access in the beginning, or if you don't have a fridge or a microwave. So people are ordering food being delivered in through Grubhub or DoorDash, right? And you know how quickly your money is going to disappear versus if you're going to a grocery store and actually shopping for, you know, a couple weeks at a time. People can't do that when they're living in motels. So their money was they're going through their money much quicker. So we were really fortunate to work together with local restaurant providers who donated. I think we served, I want to say it was, I'd have to double check, I think it was like 50,000 meals by the end of what we had done over the last couple months, where we would deliver meals to all of our motels twice a week for people so that they didn't have to go out in the community, or if they didn't have the resources to be able to afford it. But that's now something that we can't even do anymore because we no longer have those people who are able to provide those meals anymore. So now we're kind of back to where we were before, where people are having to kind of figure it out on their own. And we do have a limited amount, and we do make access. So if somebody is truly in need, we try really hard to access that, or access local food banks, because a lot of food banks were open or churches were doing drives for that. But we just had to get really creative really quickly, and are now in a situation where we're having to adjust again because the resources that we were coming in are not coming in at the same rate that they were.
Kathy, do you have any questions?
questions, Bob?
Todd, Beth, Carissa.
I'll ask a question.
Oh, okay, I was trying to unmute myself. No, I mean, I have a lot that I'm thinking about, and I'm shocked at the numbers. I mean, I knew they were always really high, but I mean, hearing the statistics is mind blowing, and thinking, what can you do as a community? I mean, how much? So, is there a breakdown per person of funds spent per year on each homeless person? And out of that, how much is subsidized from either Social Security, disability, or something else that they would get? And is that permanent or is that temporary?
So, and actually this might help a little bit too, because I heard a statistic, I heard a statistic on the news a couple months ago where it was talking about how much money, average out per person, how much money each person is receiving in services. And I remember the news kind of reporting it as that like this was a surprising amount of money for an individual to receive. And so I think, and I remember thinking that I think there's a lot of confusion too in how Measure H is being spent and what we're doing as homeless providers. So there's so many different aspects to that. So if you're somebody who's literally homeless, like then that might look like shelter, and shelter is like, I think shelter was designed as like a 90-day kind of situation for somebody. And now we obviously realize there's rarely can you find housing within 90 days. Most of the people that are in shelter, if it's their first time being homeless, they might be in and out of shelter maybe within 6 months to a year. But rarely do I see people leave shelter and get housed in less than a year. And then on top of that, if you're somebody who's chronically homeless, which means that you've been homeless for either 12 consecutive months or a period of 12 months within the last 3 years, those folks are in shelter for much longer. So when you're in shelter, that's your 3 meals a day. That's the shelter workers, the service staff that are there providing case management support or security support, just making sure that people's needs are being met from day to day. Like that's just one aspect of what we do. There's also services around trying to get people caught up on their rent who aren't homeless yet, but we're trying to prevent it. There's services about trying to like help pay people's rent for up to a year, maybe 2 years while they get on their feet. So we're helping pay like a portion of their rent, but they were homeless and now we're trying to help them get back on their feet. Or there's permanent supportive housing, which is actually subsidized housing. And then that's when we're working with the housing authorities. And it's not necessarily money that's coming from Measure H, it's money that's sometimes it's coming from the federal government in the form of a housing subsidy. So the way that money is spent per person can look so drastically different. And it can look like a lot of money because when we're putting people in a motel, for example, because we don't have enough shelters in LA County. So even before COVID, we were already using motels. So the cheapest we've been able to get people in the motel for a month is $2,000. So that's $2,000 per person a month just in the motel cost alone. We're paying people's rent, as you can imagine how expensive rent is. We're paying people's rent each month. And then you've got to consider all of the case managers and services attached to that. So it is a significant amount of money that's being spent, but this is money that's trying to be spent in a way to get people stable so that they don't have to experience homelessness again. Because if we're just putting people through shelter every 90 days and watching them just kind of come back around as soon as they kind of get stable, but then fall back into homelessness, that's increasing their trauma and increasing their risk of becoming chronically homeless. So it's a long drawn out answer to say we could try to research around the numbers, but I think it varies in like what kind of services they're receiving. A lot of the services are paid for by the Measure H funds. But when it comes to things like the subsidies around housing, which are more permanent, so the Measure H is usually more temporary, the more permanent subsidies, a lot of times are more of the federal or state, and from the housing authorities.
What?
But I would say a lot of the services that I'm looking at Crystal like she has the answer.
Oh, what's wrong?
A lot of the services are from our Measure H funds. So I mean, that's the other thing too, is that I know there's a lot of controversy around Measure H and whether Measure H is working and whether or not that's a good use of our money. And that, I mean, all I can tell you is like, we're part of this process, and I'm seeing some really cool things happen in LA County because I'm seeing a lot of different county departments coming together and working together to really try to look at how do we address homelessness, and then at the same time, how do we address these systems that have kind of accumulated, have ended up in homelessness, created homelessness, and how do we also impact those, and getting everybody at the same table to have those discussions. And I don't think that happened prior to the coordinated entry system because things weren't streamlined. So everyone was kind of just doing their own thing and nobody really saw how it all interconnected. Now that we have this in place, it's allowing for those conversations to happen. When you're talking about the coordinated entry system in a county the size of Los Angeles, which you can fit states inside of the county of Los Angeles, this was not ever going to be an easy or quick task. And so we have that funding for a 10-year period. And a lot of people were hoping that they would see more progress by now because it started technically, I think, 2016. Is that right?
Yeah.
But just to get people up and running and the process streamlined and people staffed up and trying to figure out how to do this work, that takes years. So the reality is basically we're trying to get everything ready for the Olympics. That's why I tell everybody, that's why CES exists, because we're getting ready for the Olympics and getting homeless people off the streets. That's because the 10 years ended right before the LA was supposed to host the Olympics.
That's so true.
I don't know if we're going to reach the goals that we had hoped to have reached, and then COVID threw all of that off, or maybe made us think about this more seriously. So maybe in some ways it's a blessing in disguise in some ways, because we're actually forced to have conversations that maybe we weren't having before. I don't know. But I know there's a lot of controversy over how quickly things are moving. And I think people have to take into consideration just how long it's going to take to tackle homelessness, because you're not just tackling homelessness, you're tackling all of the other systems that are broken that led to that. Mm-hmm. And then you're having to pay people to do those kind of services. And that's tough too, because that's a lot of human beings that are on the ground trying to do this kind of work. I just give you a really long-winded answer, Kathy, and probably didn't even really answer anything that you asked.
No, I mean, I find everything that you say interesting, and it's like, whenever you and I talk, and in the past, you always make me really think about my surroundings, because it's easy for me to sit in my house with my kids and have my own problems, but it's so much bigger. And I know that it's out there, and I know that we have these problems, and it just seems like that what you said, I'm pretty sure that the majority of LA County has absolutely no idea that what you said exists. They see the homeless people, they see them walking, they see them begging for money on the side of the freeway, but they don't understand everything that goes into that system. And if it was more vocal, then I believe that more people would get behind it. Just like, using George Floyd as an example. Look how many people came out and protested just for one person, because they were finally fed up, and they were finally, you know what, we have to do something about this. And not in just the state that he lived in, but in all these other states, because it just struck a chord finally with millions and millions of people. And it's like, how do you, I always say you have to get in front of the people, you have to get your voice heard. How can what you said get out there without saying, oh, go to this website or go to that website? I mean, we protest for everything else. Why can't there be a protest for this?
Yeah.
So that's your next job. No, I'm kidding. On top of everything else you do, figure that out too, okay? I'll support it. I just don't know how to do it.
Trying to figure it out too.
I mean, literally, you were sitting here saying about like food and stuff, and I'm thinking, you could call like the food trucks and just have them rotate one every night, a different one. I don't know. It's definitely something that needs to be taken care of, and not something that would happen overnight. But I think that if enough people heard you and heard what you're saying, I think you could create a lot of positive impact with that.
Does LA County have a ministry similar to like Family Promise?
Yeah, so Family Promise, it is part of the, so I know I keep talking about the coordinated entry system, and that's like a whole nother discussion, But the idea behind the coordinated entry system, as well as holding us accountable to make sure that we're serving our most vulnerable, was also to try to bring everybody together. So bring all of the resources to the same table and figure out how we do this strategically. So the way that it would work in a perfect world is that you would have your privately funded agencies like Family Promise and your other faith-based organizations that have really been involved in the homeless services discussion since the beginning. And that's the thing about homeless services, is it started out very much as a faith-based, volunteer-oriented thing. And so I do believe that there's a lot of faith-based communities out there that don't love the coordinated entry system, because it's sort of like the government came in and got involved and started to control the conversation, whereas that used to be something that was more of a faith-based conversation. And so I think you see a lot of division now that maybe wasn't there before. The bummer is, in a perfect world, if this would work the way that it should, you should have the private companies and those faith-based companies come to the same table as these companies that are contracting with county agencies, and look to say, hey, as a faith-based organization with private funds that maybe is really small, and Family Promise, where we're looking at usually moving families from church to church, that's not a kind of organization that's going to be able to serve someone who's higher acuity, meaning that has a lot of higher barriers, because you can't have somebody who has a lot of barriers or trauma or disabilities moving from church to church to church. That wouldn't really be practical. And then Family Promise tends to be a shorter program. Like you're looking at like 90 days, maybe 6 months, depending on like the situation. So they're really focused more on families where it's their first time experiencing homelessness, or people who are really close to finding housing, but they just need like a little bit of support. There's nothing wrong with that. That's awesome. Like they serve part of our homeless population that definitely needs that assistance, and they can serve them really well. But the government contracted agencies, or like the nonprofits that are getting those county contracts, like the agencies that Chris and I work with, we are mandated to work with the most acute. So like people who have the highest barrier, the chronically homeless, the people with a lot of trauma, people who've experienced a lot of mental illness. Chris is talking about like we have programs that work specifically with people who are sex offenders who can't get housing anywhere else. People have come out of the criminal justice system and can't get housing anywhere else. People who don't trust any of these systems, who are not going to go to a faith-based program. People who are still actively using, and we use a harm reduction model. So we don't ask people to stop using. We say that until your basic needs are met, you can't really deal with all the other things that you're dealing with. So let's meet your basic needs for shelter and housing and food first, and then we can have those discussions. We're dealing with a different type of population. If we all come to the same table, now the entire homeless population is being helped by somebody who specializes in a different part of that population. But if we all fight and don't come to the same table, which is what often happens, now we're fighting over like which people we're going to serve. And that's ridiculous, because the reality is that we're already set up to serve different types of people differently. So why not look at our strengths and our abilities and come to the same table and work together to do that well? And I do think Family Promise is a good example of an agency that is trying to do that, because they oftentimes are very involved in the coordinated entry system when they don't necessarily have to be, because they're not getting funds from the government. Usually they're getting more private funds. They don't necessarily have to come to that table, but when they do, I think it makes us better. But there are a lot of faith-based, I can say as someone who values the faith-based community and thinks that that needs to be a conversation, I've been really disappointed in a lot of the conversations that we have in the San Gabriel Valley, for example, because that's where I work, where there's all of these churches that represent all kinds of different ethnicities, which is awesome too, because they're able to reach be able to reach people that a lot of us can't reach, because they represent different ethnicities that sometimes are a little bit silent in homelessness. Like for example, like the Asian communities, we don't always, they're sometimes a little bit more invisible when we're having these conversations. They're there, but we just don't always recognize that they have that need. We have some Buddhist churches, for example, that have come to the table, and it's been awesome because they've been able to actually advocate for the specific needs of the Asian community that we would not have known about had they not come to the table. They're so important in this conversation. But for those churches that have said, no, I don't want to come to that table because I'm upset that now the government is controlling the conversation around homeless services, and we used to control that. Now the government is. So like a pride issue, now they're not coming to the table, and it's such a bummer because we're missing not only a huge resource, but we're missing the ability to reach members of the population that might be invisible to us, that we didn't even really know were there and needed assistance. And nobody's being able to be a voice for them because those people are silent and not coming to the table. So I've been frustrated because I think that the faith-based community has a huge role to play, but are very often not there because they see this as, well, the government took over, so I'm going to let you do your thing and we're just going to do our thing. This isn't going to work unless we do it together, which is one of my soapboxes. And I may not accurately reflect the way that everybody thinks, but that's something that I found very frustrating.
I agree.
Thank you, Carissa. Beth, it looked like you had a question to ask at one point. I don't want to cut you off or end this too early.
No, I wanted to kind of ask a question of, like, you talked about a lot, and I know for me, when I'm hearing something for the first time, it can be a lot. So I'm just wondering if people have more questions and want to learn more about this, and maybe specifically the organization that you work for, what are some next steps for people to get more information, to learn more?
So on my soapbox, I think the church needs to understand the coordinated entry system. I know it's complicated, but I think you need to understand it. Because if you don't understand it, you can't join it and you can't be a part of it. Because if you can understand the coordinated entry system and understand who the players are in that, then now we have an opportunity to collaborate. So that was part of what we had talked about with that youth shelter.
Explain what that is.
Yeah, so I mean, it's the coordinated entry system is kind of a HUD mandated way of doing homeless services that cities are kind of adapting over time. Not everybody does it. I think it's a different way of looking at how we do services. And so LA County right now is in the midst of that. But it's basically saying, it's streamlining the process. So basically everybody who experiences homelessness is getting assessed with the same tool and getting put in the same database that we all have access. Well, I mean, no, I'm not trying to, we all have, those of us that have the ability to manage confidentiality have access to. And then we're basically, so LA County is divided up into 8 regions. And so each region has a homeless services provider responsible for the youth system, for the family system, the single adult system, and then we have veteran services. So my agency, so I've worked for a youth agency and I've worked for adult and family agency. Carissa currently works with veterans. So basically it's different agencies that cover all the different populations experiencing homelessness. And then we work together to basically have conversations at 8 of these different tables across LA County, where we're bringing together all of the different providers who in some way impact people experiencing homelessness, from DPSS to Children and Family Services, to Department of Mental Health, to Department of Health Services, and to all of the providers, whether they be contract-based or just privately funded, and trying to get everybody together to say, hey, here's our list of people experiencing homelessness in LA County. How do we, first of all, who's the most vulnerable and needs those services first? Who are those people who have medical needs and need to go specifically to a medical facility? Who needs mental health services and gets that kind of services? And basically making sure we're meeting needs accurately and effectively and equitably. And then getting people en route to getting connected to the housing resource that's the most effective for them. So some people might just need assistance with rent for a couple months. Other people might need subsidized housing for the rest of their lives. So we're trying to do this collaboratively and looking at the same database so that we're not duplicating services and we're not working in silos. And we're actually saying, okay, this person is higher acuity, which means they have more needs. They need to get that more supportive housing resource. This is someone who probably just needs a little bit of assistance. Otherwise, they've got it. They can do this on their own, or they have a natural support system in place to help them. Cool. Then they can use this resource that doesn't need to be as long-term. So it's just a streamlined approach to looking at homeless services. So it's not just a bunch of random people doing random different things. That's my like Sarah version of explaining CES. But that, I mean, that you could spend, I mean, I do presentations for I used to do presentations for CES, and that was literally what I would do, is just go explain what the coordinated entry system is, and that itself can take up a whole hour because of the nuances involved with that. But I do think that you have to understand it, and that was the whole point of us trying to get FCC Burbank on the same page with the people that were running that youth shelter, so that they could understand what was going on, like how to connect people experiencing homelessness in Burbank to the right providers and being a part of that discussion in Burbank. I think that's the first step. From there, I think you get involved with the different people in your community who are doing this kind of work and actually ask them, what is it that you need? We get a lot of donations that are labeled for specific things that people who are donating think that we need. And it's not necessarily what we actually need. And it's not saying that anything we're not thankful for all of it, because it's all wonderful. But you would be surprised how much money we can't always access when we need it, because it's been designated to something specific, and how little people actually want to pay for things like our operating costs and the services that we provide people at the shelter, for example. Like very often our physical shelters, I think very often run deficits because there isn't always enough funding through our contracts to provide everything that we need. So we really like rely on donations and fundraising and things like that. But people like donating to specific things and don't always think about the operational costs of what it costs to keep a shelter running. And maybe that's not really like a exciting thing to donate to, but without that, we can't function. Like what happens when you have to replace the carpets or fix the air conditioning, like things like that. Like they're things that are not like fun things to talk about, but those are your day-to-day things that keep something healthy and safe and nice for people who are living there, that we don't always have. It's harder to get the funds for.
Mm-hmm.
So really getting involved in finding out who are the players and really talking to them and understanding what is it they need so that you're actually meeting that need. And then talking with your community, because the biggest thing about homelessness is the stigma attached to it. And so if you can talk to your community and get your community on board with the different things that come out that we're voting on, and the different things that happen at a city council meeting you might never know is happening, those things are really important, because that's how we get our community on board with the things that need to happen to serve our homeless neighbors.
Well, I think you've given us a lot to think about. Deeply appreciative of that, Sarah, and your perspective. And you too, Carissa.
Yeah.
And Sarah, are you comfortable if we follow up with you with more questions? If somebody thinks about something, goes, oh, I really wanted to ask her that, can we approach you, text you, email you something?
Yeah, definitely.
Okay, great. I am recognizing time, so I think we're going to wrap this up unless there's one last thing you want to say, Beth or Kathy.
No, I'm good. It was very interesting. Thank you for sharing and taking the time tonight to do this.
Yeah, thank you, Sarah.
Yeah,
Thank
great.
you.
Thank you.
Sarah.
Deeply appreciative.
Thank you so much, Sarah and Chrissy, for being here.
You guys. Oh, thanks, Mina. Thank you guys for hearing me share and verbally process, because there is a lot of things that we're learning. Like I said, we're learning a lot as we go. So I appreciate you guys' patience too, as we try to answer some of these questions, because we don't necessarily have the answer for all of them.
It's good to hear you verbally process. I always view you as somebody who has everything always figured out.
Never. I love verbally processing.
So this is great. All right. Well, it's good to see everybody. Miss you, Kathy.
I miss you guys too.
Miss you too, Mina. I see you weekly though, Mina. She's still there.
Oh, yeah, but yesterday I had to miss.
Oh, that's true, but that's okay. We can miss church once in a while.
Oh no, I went to church.
All right. Well, 21 above. Well, Beth, do you have anything else to add? I should refer to you.
No, that's great. Thank you.
All right. No,
Next month is back to regular schedule, right?
God, I don't know. What is regular anymore?
Exactly.
Well, about July 6th, probably.
Well, we started having it on the last Monday of the month.
Oh,
That was the schedule we'd followed for a couple months.
that's right. So June 29th. We'll get back to you.
Yeah, pay attention to the weekly email and Facebook. We'll give fair warning.
Okay, no worries.
We're still trying to, yeah, things are unpredictable. Schedules shift and change. All right.